In EKG video tutorial number 9, we are going to briefly review 3 drugs that are associated with electrocardiographic changes in the setting of toxicity. The first medication toxicity we're going to review is tricyclic antidepressants. Now, these medications, such as imipramine and amitriptyline, are widely prescribed for a number of uses, and unfortunately, they are fairly dirty medications in terms of they have a fair number of side effects. One of which is pretty significant toxicity. Tricyclics are one of the one pill can kill a toddler type medicines, so it's always important to make sure that if parents have these types of medications in the home, that they keep them under careful lock and key. Tricyclics tend to be prescribed for a number of indications: atypical migraine headaches, insomnia, chronic pain syndromes, and then, of course, depression. In terms of electrocardiographic changes associated with TCA toxicity, we're going to definitely see some tachycardia. That goes along with the anticholinergic and adrenergic stimulating effects of the medication. Also, the alteration of sodium channel functioning is going to precipitate QRS complex widening and then sometimes some QT prolongation. If you look over in lead AVR, you're going to see this funky R wave. Here we can see a Q and then this terminal R wave here. And then over in lead 1, we can have, we see here an R and then this slightly tooth-looking S wave, which is broad S wave with the prolonged QRS interval. These patterns are going to be fairly specific for tricyclic antidepressant toxicity. So if you plan to work in emergency medicine or critical care, remembering these types of patterns may be helpful to you. Here we have a 12-lead EKG in a patient with tricyclic antidepressant overdose. We can see a tachycardia. Here it appears that the rate is about 120. The rhythm is hard to detect because we have no sinus P wave, so I have a broad complex tachycardia, and we're going to immediately include toxicities along with hyperkalemia and everything else in our differential. We can see that the QRS is widened. We can see that the QT interval is prolonged. When we come over here and look in this lead 1, we see this R wave coming up, and then this very broad S wave here. We see a Q wave here, and then this terminal R wave. Those are, of course, are changes associated with tricyclic antidepressant toxicity. Next, we're going to look at EKG changes associated with cocaine toxicity. Unfortunately, cocaine in various forms is widely used, and it has profound toxicity in higher levels. Usually, cocaine toxicity will present with a sympathomimetic toxidrome. That's going to be tachycardia, hypertension, diaphoresis, mydriasis, and then delirium. These patients are a handful. If they do have clear mental status, they're frequently quite agitated. Now, if they do have significant toxicity, they may have EKG changes. Typically, this is going to be a wide complex rhythm with high levels of cocaine, and we're going to see this broad complex tachycardia as a result of the sodium channel blocking effects associated with cocaine, its metabolites, and sometimes its adulterating agents. Here we can see this kind of bizarre wide complex tachycardia. It looks like the rate is going to be around 150. We are not going to be able to find any discernible P waves, so we have a fast, wide complex tachycardia, and so cocaine toxicity should be in our differential. And so if we look here, we're going to see something interesting. Here we have a Q wave, and then this kind of high peaking terminal R wave. Those are just a couple of things to look out for in terms of cocaine toxicity. Lastly, we're going to have digitalis toxicity. Now, digoxin is a widely prescribed medication, perhaps less so than it used to be. It is usually used in the setting of rate control and atrial fibrillation, or perhaps more commonly as an adjunct medication to reduce hospitalization in advanced heart failure patients. The patients that receive digoxin typically are older and have multiple morbidities, with renal insufficiency being among those. And so anytime you see a patient with altered mental status, arrhythmias, visual changes, seizures, and you're not entirely sure what's going on with that patient, you should consider checking a digitalis level if they are on digoxin, particularly if you see EKG changes like the one shown here in terms of this depressed downsloping ST segment, sometimes called a scooped out, downsloping here and more rounded and scooped out here. Here is an EKG showing the fairly typical changes. Here we can see this kind of flattening of the ST segments here, blunting of the voltage of the QRS complex on the limb leads is noted. a bit more prominent on the downsloping ST segment depression here in V5 and V6. Now, to be clear, digitalis effect is just the effect that the medication has on the appearance of the ST segment on EKGs, and that can be a sign of digitalis toxicity, which is established by clinical picture and then a digitalis level. Next up will be the final video in this series, 10.0 on devices.